Hello, everyone, and welcome. And thank you for tuning in today for Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we're talking to Vicki Good, who is the Chief Clinical Officer at the American Association of Critical Care Nurses, about the AACN's new Healthy Work Environment National Collaborative Program. So, hi, Vicki, how are you?
Hi, I'm great. Thanks so much for having me.
Of course. Thank you for being here. So let's jump right in. What are the standards of a healthy work environment in healthcare for nurses?
Well, so AACN actually defined the six standards for a healthy work environment in 2005, believe it or
Mhm.
not. So they're, well over 20 years or almost 20 years old now. I can't do my math. And there's six different standards.
Mhm.
The first one is skilled communication. The second one's authentic leadership. Third is true collaboration. Fourth is meaningful recognition. Fifth is effective decision making. And the last one is appropriate staffing.
Mhm.
And so a lot of times people say, well, so which one's more important than the other? And there's not one that's more important than the other. They're all
Mhm.
equally important and they all interrelate. So you can't have one without having the others present.
Absolutely. So, how can implementing these standards impact nurses in the work environment?
Well, the evidence is clear that having a healthy work environment is cornerstone to nurse well-being and retention.
Mhm.
But now the research even demonstrates that the having the healthy work environment also impacts our patients. So patient outcomes improve. On the nurse side, intent to leave goes down, burnout goes down, moral distress goes down, and that perception of quality of care goes up. But not only does the perception of quality of care goes up, the actual quality of care goes up when you have a healthy work environment.
Interesting. Yeah. So, how can CNOs specifically aid in implementing these standards for nurses on their teams?
Yeah, so the CNO is the role model for nursing practice.
Mhm.
They are the ones that is the leader in this, and they have to role model not only establishing the expectation for having a healthy work environment, but also role modeling the communication, role modeling effective decision making and collaboration, bringing the team together. They have to foster the visibility and the enthusiasm for establishing a healthy work environment. They have to mentor the nurses because a lot of times nurses may not know how to make decisions or how to have a collaborative discussion. And so they have to mentor that behavior. Another way that CNOs can really foster healthy work environments is build these standards into your performance management system for your nursing staff so
Mhm.
that that becomes part of the expectation, part of the behaviors that are expected from the nurses. And then lastly is making sure that nurses are fundamentally involved in all of these decisions and they are involved in establishing the framework for a healthy work environment because the nurses have to have a voice at the table, and it can't become a top-down approach. It's got to become an approach of we. We've got to work together to establish this healthy work environment.
Absolutely, that hits on that true collaboration pillar.
Yeah, definitely. Yeah.
Yeah, so speaking of, collaborating, can you tell me all about the HWE collaborative program, the Healthy Work Environment program?
Yes. So this is going to be not only an education opportunity, but it's going to be a mentorship and a co-learning program.
Mhm,
And the thing that's going to set this apart is number one, it's going to go national. And
mhm,
number two, it's going to be interdisciplinary. Because the one thing that we realize is nurses can't do this alone. If we're going to impact the work environment, we got to have the entire team together. So we've got
mhm.
to have our physician colleagues, we've got to have administration, and we've got to have our ancillary services all working together. So the national collaborative will involve three regions: East, West, and Midwest.
Mhm.
And there will be 45 hospitals total, so about 15 per region. And within the hospital, what we're asking the hospital to do is to consider 3 units. And so they have to have 3 units signed up. And what we're encouraging is for them to think about the um, the healthcare continuum when they think about
Mhm.
it. So if I'm using a trauma ICU as one of my units, and an ICU has to be one of the units, but not all.
Mhm.
So we could have the emergency department, the ICU, and maybe the step down floor. So looking at that patient continuum of care, and how do we impact the work environment in that entire continuum so we can really focus on pulling together. It will be a 24-month journey. So it'll start in April of
Mhm.
2024. We're taking applications now and they go through the end of January. If you're selected to be one of our hospitals, then the journey will launch in April and go for 2 years, where we will provide coaches and guidance and educational sessions and mentor sessions to encourage and help the team problem solve on what are the biggest issues they need to solve for their work environment to improve it. So this is really late breaking, groundbreaking work because
Mhm.
it's never been done on a national level.
Yeah, absolutely. So, how was the program kind of brainstormed? What was the process there about, what kind of materials it's going to cover and things like that?
Well, it's we've been pulling together teams
Mhm.
to look at that to say, okay, what do people need? And we've also taken learnings from as we've worked with hospitals.
Mhm.
There's many people that have been involved with AACN through the years that have done coaching and mentoring of hospitals and how to establish a healthy work environment. So
Mhm.
we're pulling those best practices in. But then we're also going to do a lot of learning from these groups. So as we bring the teams together and we start to problem solve and do rapid cycle improvement, we're going to learn more and more. So we realize there's a lot we don't know. The national studies have shown us that the work environment has got to be improved, and there's pockets of research out there in how to do it, but there's not a global approach to it.
Gotcha, interesting. So, I know it hasn't launched yet, but what are you predicting the outcomes and impacts to look like from the program?
Yeah, I think we're dividing the impacts into a couple of different buckets. First of all, for the organization, we expect to see an improvement in the healthy work environment.
Mhm.
The health of the work environment. We expect to see staff satisfaction and staff engagement scores go up, as well as staff retention. On the nursing front, the nursing team, we expect to see that intent to leave go down.
Mhm.
There's great debate out there right now. And do we
Mhm.
have enough nurses? Do we not have enough nurses? But there's not a debate on the fact that acute care nurses are not staying in the hospital. So,
Mhm.
how do we help them stay in the hospital? What they're telling us loud and clear is we need a better work environment to work in. So, that's one of our primary targets is how do we improve that nurse retention, but also how do we decrease moral distress of our nurses? And where we see moral distress is in the fact that they feel like they can't get everything done, or they
Mhm.
feel like the work environment is too difficult. So how do we decrease that moral distress that our nurses are feeling? And then our perception of quality of care. And then third, we also want to look at patient outcomes. So
Mhm.
honestly, right now we're trying to figure out what patient outcomes do we want to measure. We know we want to look at patient satisfaction, potentially pressure injuries, falls, and then we're looking at some of the hospital acquired infections. One thing that we want to do is make sure that hospitals don't have to measure something else that they're not
Mhm.
already measuring. And the good news is most everything I've talked about, most hospitals are already measuring those items.
Absolutely. So does that nurse burnout also is that also impacted by workplace violence in the workplace?
Absolutely. Yeah, absolutely. And we do
Mhm.
expect that, some of our teams may even want to look at, how do they prevent workplace violence as part of their collaborative
Mhm.
discussion.
Absolutely. So what I know you kind of mentioned it a little bit earlier, but what do you think other health systems are going to be able to learn from this program?
Our biggest focus, really, for other healthcare systems is how do we collect that research and
Mhm.
get hard research out to people to show that focusing on the work environment is really going to impact all these different parameters that we're looking at. So
Mhm.
dissemination of research is going to be a key focus of our work moving forward. I think it's also going to teach organizations how to pull together cross-functional teams and work towards a common goal, because most of the time in the hospitals we're really focused on siloed approach. The
Mhm.
ICU may work on something, med surg may work on something, the ER may work on something else, but how often do we pull those cross-functional teams together to all work together to achieve a common goal? So I think that'll be another learning. And then lastly, just how to systematically implement these healthcare work environment standards. They've been out there, like I said, for almost 20 years.
Mhm.
But we've continued to struggle in how do we disseminate them and how do we operationalize them. So that's going to be the other main focus, once we conclude the collaborative.
Absolutely. Well, this is all very exciting, and I'm really looking forward to seeing how the program's gonna play out. Um, I think it's
Yeah,
gonna be
absolutely. We would
yeah,
love to do like a, midway touch base and let you know what we're learning so far.
absolutely. Yeah, that would be great. Well, thank you so much for your time, Vicky. I'm really grateful to have had this opportunity to hear your insights and learn about this program. And thank you to our audience so much for listening.
Yeah, thank you for having us. And, if anybody has any questions, they can get information on our website very easily just at aacn.org.
Absolutely. Well, thank you so much, Vicky.
Thank you.